Well, good morning, everyone. I'm Holly Quang, president of the Delaware Area Chamber of Commerce. I want to extend a special welcome to our friends to the north from the Marion Chamber. And as we always do here at Delaware Safety Council, we start with, I'll stop. We want to welcome you to the 5th meeting of this unusual BWC fiscal year by presenting. Now, if we were all in the same room, everybody would collectively be saying, seriously, dude, what the heck were you thinking? Thank you. I see some of you mouthing it. Brought to you this month by putting your nose where it doesn't belong. And we all know that we should not do that. It's impolite, but it's also a safety issue. For example, you probably don't want your nose or the rest of your face where this guy's being. Yeah, see, it loses something when you can't hear the laughter. That's real smart. Yeah, I don't know what this guy's issue is, but that is the dumbest thing I've ever seen. Here's another one. Wood chipper. Reminds me of the movie Fargo. That didn't go so well for them. Nothing bad could happen here, right? Here's someone who doesn't understand the physics of oxygen. And nothing could go wrong here either. So, don't miss the next episode of Seriously, Dude, what the heck were you thinking?
Heck were you thinking? Yeah.
Thank you. There's Holly. Billy. There's
good
Billy.
Job, Holly. My wife was laughing the whole time too. So
you should have unmuted. It's really tough to speak to an audience you have no.
It is. It's very difficult.
No reaction from. I'm going to assume you were all entertained. That's all we care about, even if it's at our own expense. So I want to introduce Deana Brant, who's one of my very, very, very favorite people. She is brilliant and articulate and passionate about her industry. And in all seriousness, the issue of COVID and mental health is real. I speak from my own experience. I'm an empty nester and I live alone, and the isolation of work, home has been very difficult to handle. And I freely admit that you don't realize what you do until you don't do it anymore, and it's cumulative. And so this is, and I think it's very important to notice this in our employees, to look for cues that they may need some assistance from us. So we're going to turn this over to Deana and have her get started right off the bat. So, well, we have time for questions at the end of her presentation. So Deana, who is the executive director of the Delaware-Morrow Mental Health Services and Recovery Board, is going to speak to us today. So take it away, Deana.
Are you able to see my screen?
Yes.
Yes.
Okay, wonderful. And the one thing I want to say, first of all, Holly, is thank you for all those amusing slides at the beginning. But in the interest of full transparency, that was really my childhood. I mean, I grew up on a farm with parents who took a lot of steps like that to kind of make it through the day. And I remember climbing ladders that were on top of wheelbarrows, leaned against a barn, trying to fix windows, and under cars in situations where I definitely shouldn't have been. So thank you for that blast from the past.
I think you're undermining your credibility, Deana. You might want to take all that back.
Oh, I would hope not. That's what got me where I am today. So thank you for having me. And I will tell you, if you're on the first slide, it says your employees' mental health. And, you know, I will say right from the very beginning of this conversation, and I certainly hope it's a conversation. I hope if people have questions that they will ask. But Holly brings up an important point that while the focus of what we talk about today is the mental health and wellness of the people that potentially work for you, we're not exempt from the impact of this pandemic either. And I'll talk a little bit about that as we go. Hang on, I'm going to advance my slide. And Holly knows this about me by now. I never miss an opportunity to talk to people, at least briefly, about what mental health boards in Ohio do, who we are. And this is just a brief overview for the Delaware-Morrow board, and I'll trust that you'll all read it. And the message, I certainly know all of you in Marion County have a mental health board there as well that works very hard. And our sole purpose is to provide behavioral health treatment, recovery, and supports for people in your community who otherwise cannot afford to pay for those things. And the one disclaimer I say to all of that is, you know, we tend to have a belief system in our community that if we have insurance, then we'll never have need for mental health board funded services. And Holly knows this very well by now. Of course, that's not the case. And at the very end, we can talk about some resources for you and the people who work with you that might be helpful to you. And I'm going to give a brief discussion about what COVID actually is at a glance, and this is from the World Health Organization. My only focus on this, and I think, I don't know about the rest of you, there was a time in my career where I was what I would call opiate exhausted, and now I think we're all pandemic exhausted. We're kind of, I think, saturated with conversation and news and discussion about this particular situation, and that's to be expected. The unfortunate piece about the work that we do and how this pandemic is different from all other tragedies, crises, situational things that we deal with is that there's no end in sight at the moment. But I will tell you, the important part for us is can only be diagnosed with a laboratory test. And I think as we go to the next slide and look at where we are in the world and look at where we are in Delaware County, we're certainly not headed in the direction where, in spite of how exhausted we are from all of the things that we have to do differently now, there's no immediate end to this. And I would say my background is as a counselor. I'm not a healthcare provider. I can say that the experts tell us we're looking at least another 18 months to 2 years of discussion about this. One of the things that Holly asked me to talk about is what we'll consider to be the new normal. And I'm going to draw you a picture of what the new normal is going to look like in terms of your employees' mental health and wellness. So, and this is a 4-phase model put out by the Journal of Preventative Medicine. And before you go, oh, Deana, this is lots of information. Yes, it is. And please focus on the top right corner, which is the long-term impact of a situation such as COVID on our community. So the fourth wave, which is trauma, and believe it or not, the rapid fire changes that we're all experiencing in the work that we do are experienced in the brain as trauma. You have a trauma response to that, and we're going to talk a little bit about what that looks like. Mental illness, both exacerbated by the circumstances that we're facing, and in some circumstances, we're going to talk about caused by the pandemic. The long-term economic injury, and I will tell you, one of the things I said in the very first slide is there's a lot that we don't know. You know, it is that very phenomena that makes this pandemic so stressful in the community because there's much that's unknown. And that uncertainty leads to a certain response in your employees. And we'll talk a little bit about what that looks like. That by itself is stressful. And, you know, in some fields, we already have workforce issues. We already have recruitment and retention issues. And now compound that with an issue like the pandemic and having to account for that. You know, one of the things I want to be clear about here too is in most serious or situations, there is a limited exposure to the situation that impacts the community. The pandemic is different. It impacts everybody. We've had to come up with a statewide plan for accounting for the behavioral health response in the community related to pandemic issues. There isn't anybody, and you may look around you and think, well, maybe my grandparents, probably not. Little kids, probably impacted. Daycares, schools, educators, workforce, first responders, employees. And as Holly said in the very beginning, even us as leaders have been impacted by this. That all by itself makes a difference. You know, there are typically in situations like this, protected populations. There is nobody that I think we could point to in the workforce who is immune from potentially the impacts of COVID. And I think that all by itself is going to impact what we do long term. Now, when you look at that fourth wave, and when you look at that piece about trauma and mental illness, and you ask yourself, well, you know, some people seem to be doing pretty well. It's true. We absolutely know from the history we have of obviously shorter term situations, there's something we call the rule of a thirds. A third of your workforce is going to be able to, you know, be very flexible, move on the fly, go with the flow, tuck all of their kind of anxiety away, and be able to completely function and act like this is no different than any other world. About a third of your workforce will struggle in the short term. Now, when I say in the short term, we don't even know what the short term looks like. So historically, that would have been, say, 6 to 9 months. We're what, 9 months into this and still seeing cases rise. And then a third of people, and this has been universal throughout the research, will struggle in the long term. They will derail, go south, and kind of what you do with those folks might look a little bit different. You know, with any other kind of community trauma, and I'm going to call it that, there's an end in sight, a definitive end in sight, where you can start looking at patterns for what you're going to see in your employees after that. And this pandemic, because it's been back and forth, go to school, don't go to school, go to work, don't go to work, go to the store, don't go to the store. That has been compounded by that. There is no end in sight. And you know, we in behavioral health care, what we do with situations like that, we do research. So you're going to be seeing for probably months, if not years to come, some measurement of what that has meant for the workforce that you work with. Now, this is a slide on and these are overall categories. Understand, if you drill down into these impacts, they're obviously much deeper than this. And when you look at community impact and economic loss, one of the things that's very apparent about this situation is some of that loss may be experienced downstream. We may not see the impact on, you know, housing or jobs and other situations, some of that for, you know, a year or two, if not longer. Let me tell you what we know about economic loss and mental health. In 2008, there was obviously the housing bubble burst, and there was a serious economic crisis in this country. We had a complete shift in who struggled with depression and who killed themselves. And I will say, I'm going to talk in a little bit of detail about that later, but we need to be planning for some of those similar responses now. We absolutely know from that situation that to be evicted or to lose a job was seen as very stressful, obviously, but to be foreclosed upon or to lose a job that was considered that person's identity frequently led to downstream very significant mental health issues. So also the impact on the community in terms of work and school closures, but not even that there's closures, it's that it bounces back and forth. That inability to get daycare, to know if your kids are in school, to know if you have to teach them now. Think about how we think about balance in life. You know, there are 3 areas in life, essentially. I mean, there are lots, but work, friends, and love. This kind of facts where we are consistently going back and forth with what's recommended really throws that balance out of whack in a way that your employees have no control over. And I want you to think about that. Loss of control is a very significant issue. Inadequate resources. So one of the things, if you go back to, and I don't know if I can, Holly, so I'm going to try, go back to this slide about Delaware County that's had 2,739 confirmed cases, but 23 deaths. And I don't mean to imply that, you know, any of those deaths were not a tragedy, but that's a pretty low rate. When you think about that, what that could be related to in a community with more resources is more access to healthcare, a higher insured rate, potentially maybe more ability for people to work remotely and not be exposed. In communities who do not have those kind of resources, this pandemic has a whole other impact. And then last, I said deficient distribution necessities. Now, really, that's a fancy way of saying people don't have the necessities. And think, would you have ever envisioned a time a year ago when we would have thought PPE was a necessity? I mean, we wouldn't have, and yet we don't have distribution systems in place for the things that are necessary now. Although I certainly think we're working on it. Now, individual impact, and I use the word uncertainty, and this comes from the New England Journal of Medicine, but you know, fear of the unknown is a powerful force, directly impacts the brain and can directly impact the ability to make decisions long term. And yet what we're saying to people, because it's what we know is true today, is we don't know a lot about this virus. And although we certainly know a lot more now than we knew in February, there each day continue to be reports of syndromes and long-term impacts and impacts on people's functioning that we weren't expecting 9 months ago. Confusion. Yeah, there are a lot of messaging out there that can cause confusion for people that we work with. And, you know, if you don't really look at the source reliably, and not everybody scrutinizes at the same level, right? And I think that's something we really have to think about. You know, we cited sources here, the New England Journal of Medicine, but some of the people who work for us really are, and we're prone to this too. They're looking at, you know, memes on social media or talking to friends. I had to resist the urge in the opening to say that I have 3 sisters who are nurses, and they have very specific opinions about how long this is going to last. But that's their professional opinion. It's not the science, right? So the need to really look at the science to alleviate some of that confusion. Some people do it, some people don't. I mean, that's the way it works. And I will say, Holly, you referred to isolation, and I think we already have started to see some of the impact of that in our community. And I can say from our standpoint, when we look at calls to our helpline, which is our 24-hour crisis hotline, they report a number of increases in a couple of areas. And I believe they're related to isolation. So an increase in family strife, domestic violence, an increase in alcohol use, and some increase in, you know, reports of depression. Isolation exacerbates that for some people. Now, I would be remiss if I didn't say to all of you, though, those of us who experience contact with the public as stressful, this isolation piece has been a bit of a relief for some people, and I want to normalize that. Not everyone has seen the need to work from home and to not have as much contact with the community as stressful, but of course, many of them have. And then last, I talked a little bit about stigma. You know, and this could go in a lot of different directions. And I know I'm talking about a lot of different things, but when we talk about, you know, the stigma of having the illness itself, but there's also the stigma attached to I'm a mask wearer, I'm not a mask wearer. You know, I go to work, I'm going to be in defiance of certain rules. I mean, there's stigma attached to that for some people. Now, the one thing I want to emphasize overall, though, is when you look at those individual impacts, uncertainty, confusion, isolation, and stigma, really those lend themselves to almost a perfect storm of people for whom all their stressors are kind of converging in time. And what we know from that historically, and I think probably expect to see this when we look at the data in retrospect, is really that causes people to make decisions that they wouldn't normally make. And I'm going to say, I said earlier in this that, you know, there are people for whom you would never expect a response to be that they want to harm themselves. For example, in these circumstances, you have to think about that differently. When those stressors converge, even the healthiest of people that you've worked with may potentially respond in a way that you were not expecting. And we're on slide number 7. Can you see this? It's the reactions slide. Are we all on the same slide? Okay. So some expected things in terms of emotional reactions. And I talked a little bit about stress over finances. And I think that's going to be a very particular, specific issue as this pandemic stretches out. As people experience the long-term financial and even housing impact related to the pandemic, you're going to see people have responses to that. I will say too, the research tells us when you think about that rule of 1/3 and those 3 groups of people who respond in specific ways to stressful events like this, you're going to see people, and the research tells us this, use alcohol to cope. Very common thing. And I by no means want to be dismissive of what you have to do as employers to manage some of that. What I will say is, if they're in that second group who struggles just in the short term, the research tells us with supports, with, you know, someone to talk to, with supports at work, that tends to be short term. They end up, if they didn't have a problem with alcohol before the pandemic, they won't have a problem with alcohol when this is all over. So I will tell you, one of the things you got to think about here too is we're talking about 2 groups of people. We're talking about your employees who potentially have had a positive COVID test. And what we know so far is that of those folks who have gotten COVID, within 90 days or so, they've experienced signs and symptoms of mental health that could be diagnosed by a professional. You know, we use the terms anxiety and depression almost like it's a pejorative term, but there's a piece that's related to this stress response that I think would be helpful. And one thing to look for in your people that you work with is insomnia. When you see people who are struggling to sleep for whatever reason, that tends to contribute on the back end to all sorts of other struggles with wellness and mental health. So we want to kind of keep an eye on that as well. And I will say, I want to make sure that my message about alcohol is not that it's okay that people drink to cope. My message about alcohol is that the science shows us if they're in one of those groups that's struggling in the short term and didn't struggle before the pandemic, they won't struggle afterwards. Now, that being said, we absolutely already know alcohol sales have skyrocketed in our country since the pandemic started. There's been an increase of about 5% nationally, which if you know how much alcohol we consume already, I mean, it's just something to think about. 5% is an enormous increase. Non-compliance with public health directives. And, you know, let's say, I'm going to say this. We are a society that is prone to judging people who respond differently than we do. And there's a young man, he would laugh if he knew I said that. Jim Wilson, he runs our housing agency here and has about 150, give or take, housing sites and multiple employees. And he said to me at the very beginning of this pandemic, you know, it almost doesn't matter what I put in place in the office. It's what people do elsewhere that matters in terms of whether or not they're going to bring things back to the workplace and we'll have issues with COVID. And I think you're going to see some of that. We certainly here have already experienced employees coming to work sick because they don't have sick time left and they don't know how else to manage that. And I think that's going to be a common theme here. It's not just what they do at the office or at the workplace that you have some, I mean, at least theoretical control over. It's the behaviors that they engage in elsewhere that could then potentially bring some of that back to your workplace. So when you look at just stressors at work and the number of adults who are experiencing depression, I want you to think about kind of what this looks like. Work and personal life, and I had said earlier, you know, there are three basic areas: work, friends, and love. And really, when people are working remotely, you're getting a window into all of that. When there is no time frame that's off limits from having to work because you're working from a setting that really is the site of your personal life, I mean, that all by itself can cause issues for people who struggle with boundaries and with rules. And the third piece on this slide is really that workers really are concerned if they go to HR and say they're struggling, what impact that will have on their career. How will that be looked at? You know, stigma it's alive and well in this country, like it or not. You know, nobody wants to be labeled. Nobody wants to see their path forward be impacted by the fact that they said or talked about openly that they struggled with managing some of these stressors. And yet my message to all of you, and I'm not sure if any of you are really in this situation, is I don't know how we can expect people not to struggle. This is a lot for even us as leaders, people who typically would be seen as having coping skills, good decision-making skills, and good work-life balance. Okay, that was funny. Some of us don't, but there is no way that this could not have an impact on the regular employee. So, you know, and I will say to this slide, you're going to have employees or people that you work with who are watching people test positive and potentially die around them. So I'm going to share briefly from my own experience. I mean, Holly knows this about me. Grew up in a small town in Northeast Ohio that, of course, initially had some immediate negative response to what they perceived as government interference in their lives. And of the people that I knew in that town, 5 of them have died from this already. So there is no way for that not to bleed over into the workplace. There's just no way for that not to happen. And yet some of our employees are actually living this in the day-to-day in the work that you do. So we know if we attend to our employees' emotional needs, that's the best way to make a positive difference. So if you ask yourself, gosh, how can I make sure that my employee is in one of those first 2 groups of 1/3, the ones who do well or the ones who struggle in the short term, and just in the short term? Well, this is how you do it. And I want to be clear about this. I don't have all the answers. I mean, none of us do, right? There is still so much we don't know about this, and we're applying what we've learned about other community incidents like this. But I've been very clear that the pandemic is not like other community incidents. So I'm going to say some basic things to kind of think about when we talk about how to support our employees in the workplace. One is that Zoom exhaustion is a very real thing. It's not the person's imagination. There's science behind this. So when the pandemic first happened, I actually thought to myself, yay, I don't have to drive all over anymore. I was very excited initially about not having to drive around 2 counties, going to different meetings, and thought that would somehow contribute to being less tired. But the fact of the matter is that 68% of the messaging we get from interpersonal communication with other people is nonverbal. So if all of our interactions with folks are virtual, it is absolutely true that we have to work a lot harder at interpreting those messages. So to understand what they're communicating is way more difficult. A couple of simple things I would suggest, and I certainly am not going to suggest anything that supersedes your policies, because I think all of this should be driven by policy, is one, if you're permitted to, in virtual meetings, require cameras to be turned on. At least then you're getting some of the nonverbal cues in terms of interpersonal communication that you would normally get. I would leave our meetings here and feel physically tired and couldn't understand why, but that really is a function of how hard your brain has to work to interpret messaging in a way that's not true when you're in person. I think the other thing that we know is you have to allow time in between meetings. So if you are someone who used to drive between meetings or close your door or go to lunch, that was a chance for your brain to kind of debrief the meeting you left and get ready for the next one. I early in this found myself scheduling back-to-back meetings all day. We've certainly learned that that's not a good idea. And I'm going to say this too. You're going to have glitches. And I hope by now, 9 months into this, in this kind of partly virtual environment, we can accept that. Not that I want there to be any Zoom hacks that involve bad things, because certainly our board system has seen that. But this is, I try to keep it in perspective, right? If the Democratic National Convention can have a glitch in their major event for the year, then so can our virtual meetings here in Central Ohio. I mean, it's just going to happen. And that's really okay. Increased ability to work from home or flexible hours. And one of the things that, and I hope the majority of you, I'm sure, have already accounted for this, but there's two sides to this issue too. You certainly want to allow flexibility when that's going to be helpful to your employee. And my experience has been as an employer over the years of hundreds of people, as well as good employees don't abuse those kind of things. My suggestion to you would be to have policy about that. And if you don't already, that kind of lays the parameters around how you can be flexible with whom and around which roles. I think that in the long term probably can be pretty helpful. And then supporting people who you're laying off. I mean, that's a painful thing to think about, but sometimes people need education about federal benefits. I mean, sometimes you might be in a position where you can afford severance. Sometimes people don't know how to go about, applying for unemployment. I'm giving that example. And if you've never had to access those resources before, I mean, how do you get good at something? You've done it before. There are people who are going to need direction with that. And I'm sure some of your HR, leaders already are working on these things. Provide a safe workplace. Now, that's subject to, opinion about what a safe workplace looks like. But to the extent that you can not add to your folks' anxiety about this pandemic in the workplace, the better off they'll be. Keep your employees' well-being as a top concern. We tend to, I think, and this is, I think, nationwide, we don't necessarily practice what we preach. We may say that our employees' well-being is a top concern, but what does that look like? And I guess, the nuts and bolts of that, boots on the ground, is really determined by each of you individually, but it's something really to think about. Looking at a question from an employee from the standpoint of, I want to keep this employee, I want to keep this employee well, how do I go about that? Provide training for mental health and wellness. There are lots of resources out there to help people cope. And the more access you can provide to those things, and frequently those things are low or no cost, the better. Remember, you're going to have a population of people who are experiencing pandemic stress responses who, prior to this, you never would have suspected would be vulnerable. It potentially could impact all of us if it hasn't already. Help channel stress into pro-social things. Ask them, what can you do to be helpful in this pandemic? And then the last one is cultivate a culture of trust and fairness. So, I think we all know you can't always treat employees equally, but you have to treat them equitably, and you want them to be able to come to you with the stressors that they experience and be able to talk about those things and know that we'll come up with a plan that is fair and also still good for the work that you do. And understand, we know business is business. You got to make decisions that impact your bottom line, and we can appreciate that. We just want your employees to have support and kind of navigating this. It's new for them too. And these are some places you can get more information. I didn't ask Holly, and I probably should have, how we were going to go about seeing if there are questions for me.
There's a chat feature.
Oh, let me find it.
No,
we'll handle looking at that.
Matt's got to cover it. So,
okay, good.
Deanna, let me ask the first question. What are the clues that that employers should be looking for in their employees? Are there things that stand out? Because a lot of people will suck it up in spite of.
Yeah, and I think that's absolutely true. Some people get really good at hiding this, and in particular, if you got people who have been known historically to have, the people you see as having a good work ethic, as being hard workers, as being typically at the office or, earlier, stay late, those kind of employees who always show up on time, they're going to try to just plow through this and get to the other side. And that may not always work because we don't know what the other side looks like. So you want to look for changes from typical behavior. So employees who typically were energetic, engaged, outgoing, who withdraw. You're also going to see people who, and I'm going to say this is something we've certainly seen across the education field, people who show their stress response who prior to this would have been completely contained. They would have been in that first group where they were able to kind of tuck it all away. You will see potentially, and I'm going to use the word outburst, and I don't mean that in a horribly negative way, but less of an ability to self-regulate, a looser filter. They're going to say things when they're angry or irritated that prior to this they probably would not have. Now those are some of the kind of behavioral signs to look for. If the person doesn't come and verbalize, hey, I'm struggling, and doesn't bring it to you to begin with, you want to look for people who, and we certainly even see this in the work that we do, who say struggling with sleep, waking up in the middle of the night, having anxiety about what work is going to look like, or a project that's going on. Now think about it like this. We're asking them to have their regular skill set at work, plus a skill set potentially of teaching their kids or taking care of their kids around the clock at a time where, prior to this, they'd had a little bit of respite if their kids were in daycare or school. We're asking them to navigate a 100% virtual environment. My kids, they're all millennials. They laugh at me about that, but it's not that simple for the rest of the population to navigate that skill set of what it takes to continue working in what could be a largely or, at least partly virtual environment. You want to look for changes in attendance that would not have been common before. So, someone who, awake at night, having anxiety, doesn't get up in the morning, doesn't come to work. You want to look for that. You also want to look for reports of things that don't seem related. Relationship issues at home, conflict with their kids, where prior to this pandemic, you'd have thought, that's life and that's what people go through. And to the extent that your employees talk to each other versus talking up the chain of command, you just want to keep an eye on things like that too. You'll also have people who are struggling financially, and it will show sometimes in how they navigate the workplace. Not having a car to get to work, struggling with transportation, struggling with clothes to wear to work. That could be a function of having to reserve their resources for other necessities in life. I could say a lot more about that, Holly, if you want me to.
Well, I think too, those of us in leadership positions have this expectation, and our credibility comes in question whenever we show any kind of weakness at all. And so for some of us, and I've said I've struggled with the isolation, and I have, and for me, I've gained weight. I find myself making mistakes in things that I normally do that I wouldn't make a mistake in. And so, and I can say this at this point in my life, 20 years ago, I wouldn't have been able to admit those weaknesses, but because there's this credibility that comes with strength and a leadership, and you're not, everything else is is questioned if you have not a strong reaction to anything.
Well, and Holly, you bring up a very good point, though. And in one of those slides, I talked a little bit about confusion, because remember, we're asking people to track a number of different skill sets at the same time to accomplish a job that used to require maybe one or two prior to this. And I want to be clear about that too. I mean, that's exactly what we're hoping long-term to impact, that there's not shame or blame in that, right? That you're going to have people who would normally have been those employees, what do we call them, keepers, you know, the ones who rarely make a mistake, have it all together, have everything kind of contained and the 90% of their job responsibilities under control. Remember though, those two other areas of life are now going to bleed into that in a way that makes things stressful. So when you think about it like that, Holly, and I guess I want to be clear about this too, how could people not be confused? How could they not make mistakes? How could they not now not be on top of things that they would have been on top of before? Their workload not only has shifted, and sometimes shifted rapidly back and forth in a way they have no control over. So when you think about how our work systems are typically set up, you know, to the extent that an employee has a job description and have duties to fulfill, they control whether or not they fulfill those. That's not really true to the same extent anymore. So exactly to what you said, the point about this being perceived as a weakness, that's the exact thinking that I think we're hoping to shift here, that we need to change our expectations around that and understand that having a point of confusion about something that they would not have had before is to be expected in this environment. Now, certainly you still need them to do their jobs and to accomplish a task for which they've been hired, but we really can't expect them to take on whole other skill sets about how they do that job and not have a period of transition. So when I used to hire clinicians, I would say 6 or 9 months in, they would know whether or not they wanted to stay. And a year into it, I would know whether or not they could even do the job, right? A year. I mean, and maybe that sounds harsh. So we're February to November into this. They're only just now figuring out whether or not they can work in this way. So I think that goes back to expectations. I mean, you bring up a valid point. I'm going to ask people to reframe that if it was a good employee before, it will be a good employee. There'll be a good employee after this. You just have to get through that transition period. And when you think about, you know, the stigma attached to this too, I mean, I could give you a couple examples of things that I've done here that historically in a million years I would never have done, mistakes that I've made. And certainly I think we've got board members who still struggle to log into board meetings 9 months later. It's a new skill set for them. So I want you to kind of keep that in perspective. And I'm giving you kind of the long version of this, but I think that's exactly what we hope will shift. The expectation that there will be confusion, there will be mistakes made, and you got to think about it from the perspective of how serious those mistakes are, or just the overall perception that they're not on top of things. It's really difficult to be on top of all things in this environment the way that employees used to be. Very difficult. I think there's no shame or blame in that. I'm not sure I answered your question.
Well, you did. No, you did. Thank you.
Deana, are there any national campaigns or maybe on some of the resources you have here on the screen that kind of, whether it's material or it's just how you phrase as a supervisor or as a boss to kind of encourage or help your workers feel more like you're caring about their mental health, like the actual like phrasing or articulation of how of kind of what that sounds like, yeah, without it sounding condescending or
right or judgy.
Or judgy.
So saying, what are you, nuts? Probably is not. Matt, are you saying that that's not a good way to approach this?
Not probably not. No.
Yes, in fact, the state of Ohio, there's some national conversations. The state of Ohio also has several campaigns actually going now, and some of them are specific to certain occupations, but I'm going to send those, if that's okay, connect those to you and send you those. They have one pagers that can just really articulate line and verse. And I'll give you one example, and there are other ones, and I'll connect you to all of those. But if you have an employee who you think is depressed potentially and just struggling, there's a model called QPR. It is modeled after CPR, but instead of starting someone's heart, you're questioning them about whether or not they're depressed and how much they're struggling. Question, persuade, and then refer them to somebody who can help them. So I can connect you to a number of those. There's one that's new from the Ohio Department of Mental Health and Addiction and the Ohio Department of Education for educators. That's specific to them, but rather than kind of verbally go over all the resources, I'll send those to you and to Holly for you to distribute as you see fit, if that's okay. And I agree with you. We talk about this all the time, but again, going back to how you get good at it, you don't do it all the time. Those one pagers can be incredibly effective tools.
So we have a question about what we predict the governor is going to talk about tonight. And while we will probably know late this afternoon, the governor's office, and they probably reach out to you as well. This is only guesswork on our part. It would seem to me that he's going to probably suggest we close down again. And that's just my opinion. I have no pre-knowledge of anything at this point, but
I'm in the same boat as you, Holly. I mean, I probably will get a call this afternoon ahead of that press conference. Right. And, obviously the fact that it was moved from yesterday at 2:30 or 2 when it normally is to today is a significant thing. I had two thoughts, and, I don't predict three things. I don't predict what my board will agree to ahead of them voting, because, that can backfire. I don't predict what the Cleveland Browns are going to do, because I've just given up on that. But I'm reluctant to say my sense is probably that it's going to be about some form of a shutdown or directly connected to schools, because, schools across the state have had various, pandemic plans in place. But my suspicion is it's going to be potentially around one of those two things.
So we have a question from Molly over at the library. She's asking about specific things we should look for managers or middle managers and supports in this. And this goes back to my question about when you're in a leadership role, you're expected to be above the impact of all of this because you're a leader. And if you show signs of stress or weakness, it sort of dilutes your credibility in everything else you do, because you're a manager. So how can top management help middle managers support their issues and help them maintain their credibility as a manager while still experiencing what they're experiencing?
So I'm going to turn that exactly around and say, one of the things in our experience that leadership or managers can do is to practice what they preach. When they're struggling themselves, obviously not to disclose in a way that's inappropriate and contradictory to having good boundaries, but to be open about the supports and resources that person needs, the leader, in order to manage. It's leading by example. So, and I'm going to use kind of, cliched examples, but when you need time off, when you need to go see your doctor, when you need to, come in late and kind of take time for yourself, practicing that. They're in Delaware, and I'm going to use Delaware as an example, and maybe it's not the best example, but there's a wellness initiative that's run by the county's HR. So to participate in that as a staff sets an example for your employees about what you're asking them to do. So I think frequently that thinking that, we have to not demonstrate that we ourselves are vulnerable to these kind of issues, I think it frequently backfires. Now, it's not that I think that you overshare your personal information with your employees, remember, because those kind of things go up the chain or to one trusted peer. They never go down the chain. But I think it's okay to lead by example in showing that you're struggling with this as well, as long as you also share what you did to manage your response, so that you are then demonstrating exactly for them what you want them to do. I think that's really okay to do. And I know that that may not be a widely shared opinion, but I'll tell you, in the work that I do here, I mean, I've been pretty open about the fact that, you know, there have been times in my existence where I had kids who struggled, where I struggled, where I had an ex who struggled, and have talked kind of openly about what it took to get through some of that. And I think employees need to see and hear that on the level of personal information sharing that you do with somebody who's below you in the chain of command. I think they need to see it. And I'm not sure, can we go back to, was it Molly? What was her question again?
To consider, anything to consider with managers or middle managers on supporting them in this. In other words, they've got leadership roles. How do we support them so they can support those below them? And report to them rather.
Gotcha. And I think the first thing I wanted, and the second thing after what I already said, is kind of remove the belief system or address the belief system where, because you're a management or a leader, that you are immune to the impacts of this or can't let your employees see how you manage it. Because I actually think that's counterproductive and flies in the face of what would be helpful to them. It's actually typically helpful for them, even the strong leader. And I have to say, Holly, I mean, I think, you know, we've talked about this. Tend to be a pretty directive person, but what the best thing you can do is to practice what you preach about what they should do to manage the impact of this pandemic. That's the best thing you can do overall. And I know that's a more global strategy and there are lots of pieces that come under that, but I would highly recommend that.
Thank you. Well, Deana, as always, you are articulate and passionate and so smart. You're one of my very, very favorite people.
Oh,
thank you so much. Oh, you know that.
Thank you for having me.
Oh, no, thank you so much.
Looks like actually we might have one more question here.
Sure.
William Gibson raised his hand.
Yeah. Hi, Deana. I have a quick question from your point of view. So from a mental health standpoint, do you see a lasting impact when it comes to like the resentment and shaming that some workplaces might do? And, you know, it's no secret that, you know, the folks that are in the office every day putting in the work, you know, they're maybe thinking the folks that are at home telecommuting might not be putting in all the work because maybe they've got kids, they're homeschooling or whatever. So I'm wondering if you think, you know, from one side of it, they're judging or they're shaming the people that are home. But at the same time, you've got the folks that are working from home, putting in the work, maybe feeling some shame or some guilt because they're not able to, you know, fully fulfill their roles in the office. Do you see maybe a lasting impact that might be tough to come back from once all this is hopefully over one day?
Well, and Holly, you know, I have a million responses to that. And let me say, I think there are two sides to that issue. And I think this is one way we're going back to Molly's questions where leaders can kind of address some of this. So do I think the people who have to go into the office every day either resent or envy the people who are working from home? Absolutely. I think you're going to hear about some of that. Do I think there's a way to frame this for them that the working from home where there's a, you know, competing responsibilities, the potential for virtual glitches, you know, the need to really be able to manage your time when you're trying to help your kids go to school, for example, in a way that is almost more stressful than being able to come into the office and do your work and be there for 8 hours and get it done? Yeah, I think that those kind of issues are going to exist, and you're going to see some interpersonal impact on that when people come back to the office, if not before. I'd be absolutely open about calling that out and addressing it. But part of addressing it for me, though, is the ability to see, again, both sides of that. Yes, the people at home, feeling some guilt about not being able to function as efficiently and effectively. And also, if they grew up with the thinking that work ethic is attached to going into the workplace, then they're going to feel some sort of way about that. That's not okay. The people having to come into the office feeling like, okay, well, I'm the one potentially being exposed to the virus in a way that other people don't. I'm carrying the load for people who are at home and get to be flexible about, what their workday looks like. I think it's going to be really important eventually to have those two groups of people talk about what their experiences were like, because I think there's stress on both sides of that just aren't acknowledged necessarily yet. Again, in what we do, we're going to study this, and a year from now, we'll probably send out information about what those two groups of folks long-term, the impact it had on their employment. Did it lead to increased retention? If you got to stay home, did it lead to increased retention if you had to come to work? I mean, we're going to eventually study that. But yes, I think we have heard some conversation about that. And I think it's going to be important, as it is in every situation like that, to help each group see the pros and cons of the other work environment, because it's certainly not as easy as it looks to be juggling all of these things from home.
Deana, there's a suggestion from someone on the meeting that you have a relationship with the superintendents of the schools, because we know that the schools have a specific, they're in, they're out, they see their kids 2 days a week, not the other 2 days a week, and you could get dizzy just trying to follow their schedule. I know that in Delaware County, and I suspect in Marion County as well, our agencies have one of the reasons Delaware County has fared so well, I believe, is because all these partnerships were already in place before the pandemic hit. Our school districts and our agencies work very closely together. So can you comment at all about the relationship between mental health providers that you're seeing in relationships to the school districts?
Well, let me first say too, schools are, in a terrible situation in many ways. And I'm going to say that I think it was stressful to be an educator before all this happened. And much respect to educators. I don't know how they do it, because I know I certainly couldn't. And so I think that the changes with COVID, and of course for them, again, rapid fire changes, even day to day, week to week, over which they have no control, has been incredibly stressful. Yes, most boards have good working relationships with schools, and ours, and I'll speak from the Delaware-Morrow standpoint, and I know some of this is also true with my peers north of me. We fund services in the schools, lots of them. From prevention, early intervention, crisis intervention, to ongoing mental health counseling, both individual and groups. One of the things that we recognized very early on here as a board is that the prevention and intervention services that we provided were student specific, and it was the educators who were struggling. And then if they're struggling, it's kind of like the mentality of, if you're on a plane and the oxygen mask comes down, what's the first thing they tell you? If you have somebody with you who you're caring for, you use the oxygen first and then help your person put the mask on. Well, we realize we got to help teachers in order for teachers to be able to help students. So here, one of the things we put in place beyond this switch to, mostly virtual model of service provision for the schools who were virtual, for the students, the teachers needed help. And so we have a provider who put together a support program at no cost to educators who could come in and and talk to somebody anonymously, which is very important, and confidentially for a certain number of sessions to kind of figure out how to get through this. So I think that's going to be a very important piece as we move forward as boards, and we're no different. We put millions into school-based services, but it's for the students when it's the educators who might need the oxygen, if that makes sense.
Absolutely.
So we're experiencing a little bit of a shift there. So when we talk about in the state of Ohio, you know, I talked a little bit about depression and suicide. We yet, and we probably won't see this until we look at next year's data, have not seen an immediate increase in what we call completed suicides, but we have seen, we also saw this in 2008, is a shift in who. So we've had some educators in Ohio kill themselves. So we already knew we need to be paying attention to what that shifting landscape for educators looks like and the impact it has on their brain and their well-being. So I think we're going to be doing a lot of work with that. You can't help the students when the teachers are floundering. So
what a great analogy, Deanna.
yeah.
Well, thank you so much. Thank you to everyone who stayed with us on the call. Thank you for your interest in this topic. I think it's really important, and I applaud you for being concerned about this. It's not easy. I know, and Deanna will agree with me that the older we get, the wiser we get, and the less stigma there is attached to speaking out about our own experiences. And I would encourage those of you who are working up the career ladder, who are in positions of authority, to not be afraid to share your experiences and not be afraid of the repercussions of experiencing what you're experiencing, because it's real. And your analogy of the oxygen first is absolutely brilliant, Deanna. If we take nothing away from this today, that is absolutely brilliant. Thank you, as you always are.
Thank you for having me.
Thank you. So
Thank you, Deanna. Great questions too.
Yes.
Excellent presentation.
So next month is Marion, and I think we're going to act surprised. We haven't heard yet what that topic will be. And
TBD.
CBD. Oh, CBD.
TBD.
Who BD?
To be determined.
Oh, TBD. Oh, I thought we were going to talk about CBD and all that. No? Okay.
No.
So thank you to everyone again. And dude, what were you thinking? We'll be back in January. And
I have one more question.
good.
Matt, will we be able to get a recording? Absolutely.
Yes.
As soon as this meeting is over, we'll have the recording and then we'll upload that along with hopefully Deanna's slides to everyone in council.
And you can share my contact information, Holly, as well.
Of course.
We'll send both the Marion's and the Delaware-Morrow as well.
Take care of yourselves, everyone. Happy Thanksgiving, whatever that's going to look like this year for you all. And if you're traveling, travel safely and just be safe, and be safe with your staff. Thank you so much, everyone.
Thank you all.